We had a question that what happens if the fibroids gets untreated and there is no intervention. Many people do have fibroids and they don't know about it. A lot of time we do ultrasound and we can diagnose it. So if somebody has a fibroid, has pain or heavy bleeding or other symptoms, obviously we treat it. But if somebody has no symptoms, there is not necessary to do any intervention for every fibroid. They can grow and they can potentially give other problems, pressure, and sometimes they put pressure on the bladder or other bowel symptoms. Fibroids are usually not cancerous. The chance of being cancerous is 1 in 10,000. So if they are growing slowly and have no symptoms, they can be watched. And we have fibroids very small to very large. They could be like even 10 or 15 centimeter fibroids. I've had patients with a very large fibroid. Sometimes they're symptomatic, sometimes they're not. And again, there are different treatments for it, as easy as medication to shrink it, as things like EUA, uterine artery embolization that shrinks the fibroids. We can do myomectomy, we can do hysterectomy, or if somebody has just heavy bleedings, sometimes we do something called endometrial ablation with something called NovaSure that decreases the bleeding. There's also medications for heavy bleedings that can be used. But if somebody has no symptoms and doesn't desire any surgical intervention, it can be just followed up on a regular basis.